Hello, it's Dr. Rhonda Johnson. Today's Friday, July 30th, 2021. Today I'm going to be talking about what did that leaked CDC document have to say. And I'll give you my interpretation of some of its findings. So first, big point. The Delta variant is more transmissible than Ebola, common cold, seasonal flu, the 1918 Spanish flu, smallpox, MERS, and SARS, those first two coronavirus epidemics. Not good news. 2, Delta infections are associated with higher viral loads and a longer duration of viral shedding. This means that you're likely to be contagious longer than you were with the first coronavirus. Number 3, the risk of Delta variant reinfection. So the risk of reinfection with Delta may be higher than with the UK Alpha strain if it's been more than 180 days or 6 months. My translation of this, folks, if you had COVID before, if it's been more than 6 months, your risk of reinfection with Delta may be higher. So if you think that you've got so-called natural immunity and you don't need the COVID vaccine, your risk of infection with Delta variant may be higher, according to this leaked CDC document. Number 4, the Delta variant can cause more severe clinical disease than previous COVID viruses. So the Delta variant causes more disease, more severe disease, and this is based on international studies from this leaked CDC document. Studies out of Canada showed higher odds of hospitalization, ICU admission, and death. Studies out of Singapore showed you have a higher risk of needing oxygen, ICU admission, pneumonia, and death. And then studies out of Scotland showed higher odds of hospitalization. This CDC document also said that older age groups are at higher risk for hospitalization and death relative to younger people, and that is regardless of vaccination status. Now, that's bad news for people who are 65 and up. So even if you've been fully vaccinated, if you're 65 and up, you are at higher risk for hospitalization and death if you get infected with the Delta variant. Now, on the vaccines prevent more than 90% of severe disease, but they may be less effective at preventing infection or transmission of this virus. The risk of severe disease or death is reduced tenfold or greater in the vaccinated, according to this leaked CDC document, and the risk of infection is reduced threefold in the vaccinated. Now, they also made recommendations in this leaked CDC document. And one of the recommendations was for universal masking to reduce transmission of the Delta variant because it's more transmissible and there's such varying rates of vaccine coverage throughout the United States. And they also suggested that non-pharmaceutical interventions are essential to prevent continued spread with current vaccine coverage, and that we should all expect more breakthrough infections and more community spread despite vaccination. And then they summarized in this document their findings. And the summary was that the Delta variant is different than previous strains. It's highly contagious, likely more severe. Breakthrough infections may be as transmissible as unvaccinated cases. So that's all from the CDC document. That was a lot anyway. So key takeaway points, you're still better off vaccinated than if you weren't vaccinated. And that all these folks that are out there blaming the unvaccinated, look, vaccinated folks can transmit this Delta variant as equally as unvaccinated folks. They just won't get sick, but they can get infected and they can infect other people. So what we all need to do is do what they said. Take these preventive actions and take them to heart. These non-pharmaceutical interventions are what we all need to be doing. We need to all be universally masking now. Go back to the way it was. Put that mask on when we're outside our homes, when we're in public places, when we're indoor spaces. We should be universally masking. We should also be staying home when we're sick. If you cough and sneeze, folks, cover your cough and sneeze with a tissue or, your arm like that. And wash your hands. Soap and water, or use hand sanitizer as much as possible. These are things you can do today to help reduce your risk of getting Delta and variant infection. And if you don't get it, folks, you can't infect other people. You can only infect other people if you are infectious. So, how do you reduce your odds of being infectious? You get vaccinated. Now is the time, more than ever, to get this vaccine. Now, the Delta variant is likely to not be the only variant we need to worry about in the future. So get vaccinated, mask up, whether you're vaccinated or not, and be safe. This is Dr. Rhonda Johnson. As always, my views are my own. You can find this leaked CDC document online. A prominent national newspaper published it. So just search for it and you'll find it. As always, my views are my own. Stay safe and have a blessed day.